Hi, it's Adrian from Advanced Dental Artistry. One of the common problems we see with patients with upper and lower full dentures is problems with the lower denture. The upper, of course, has the palate, so that not only gives support, but normally gives very good suction. So we find that the upper dentures tend to be quite comfortable. With the lower, though, because of the space of the tongue, we find that the lower denture is just more like a horseshoe and it tends to move around a lot. Also, one of the issues is we get a lot more bone loss on the lower jaw. So therefore, as the bone shrinks, there's much less bone to actually place implants. I want to talk you through the case of Irene, who came to see us as a second opinion. She'd been told several years ago that she couldn't have implants, but with all things, technology's moved on. We've got different types of implants now, different surfaces of implants, different sizes and different widths. We've also got virtual surgery that can place implants, and we also have the ability to graft bone. In her case, when we got her scan back, she had lost a lot of bone, it had really shrunk, and there wasn't a lot of bone to place implants, but what we managed to do is use smaller implants, mini implants, and actually place 3 implants at the front on the lower jaw rather than 2, and therefore engage enough bone to support her all-on-4 bridge. So this is Irene on the first initial visit, and she's showing us that she's got 2 dentures, and this is quite common where patients will have multiple sets of dentures, some that are really good because they can chew and bite with them but don't look so good, and then they've got a set for kind of going out because they look better. And one of the problems with her old dentures is that they had worn down a lot, even though they were comfortable, so they didn't look right. But the good set didn't function well. Every time she was trying to bite with them, they would cause a lot of sore spots. So this is actually one of the sets. This is the set that is actually good looking, but unfortunately doesn't fit very well, and these are her ones that are more comfortable. You can see the teeth are very worn down here, and this is a close-up of the top and bottom. We're going to go straight to a trial smile, which is a day after surgery, and you'll see the difference here with these new set of upper dentures. One of the most important things is getting feedback from the patient. So this final bridge is going to be perfect. This is an all-on-5 bridge because of the lack of bone. We put an extra implant there at the front. On the upper, you can see the detail in the final denture and how beautiful it is. And if we look at that in the mouth, you can see a close-up of the smile. We're then going to see a portrait, and there's also going to be a lot of changes to her profile when we set the teeth correctly. We're going to listen to a couple of comments. She's going to talk about her old set of denture. Let's look at a couple of views from different angles. You can see how beautiful the smile is. And she actually had a friend that she sent to see us, and we actually also tutored her, and she's going to say some comments about her friend that came in. And look at the final smile, see how confident she is. And I think one of the beautiful things here about getting this treatment done correctly is you can really see the confidence in the patient's eyes. And just a couple of final smiles here. Well, thanks for watching, and if you are looking for a second opinion, maybe just want to ask someone some questions about dental implants, please give us a ring at 1-800-SMILING. We offer complimentary discussion visits. You can also visit us at advanceddentalartistry.com.au. I look forward to seeing you one day in the practice.